The case of Family O is a good one to highlight conflicts between principles of autonomy and principles of justice. You may encounter cases like this when you work with families that are facing problems where the members have severe substance use disorders. Justice for the person who has become dependent on alcohol or other drugs has been a topic of controversy. In order to protect people with substance use disorders from experiencing punitive actions on the part of the citizenry and professionals, the federal government has passed specific laws and developed concepts which lead away from the idea of alcoholism as a moral failing, which existed in the early 1800s. The concept of alcohol dependence as a disease and the recent relanguaging of standard reference texts are helping counselors destigmatize the treatment of individuals with substance use disorders. So let's look at the case of Family O. In the case of Family O, we can ask about justice for Joe. Joe's drinking heavily. The National Institute on Alcohol Abuse and Alcoholism, or the NIAAA, defines heavy drinking as more than 15 drinks a week for men and more than 8 drinks a week for women. Joe has admitted he drinks 6 beers at a sitting, at least daily, when he's working at home, and that suggests that he's drinking heavily. It seems like Joe is exhibiting behavior indicative of alcohol dependence. Rather than seeing Joe's behavior as indicative of a disease process in need of treatment, Christine judges Joe harshly, judges him for his continued drinking and his inability to control it. Christine is angry at Joe for being, quote, alcoholic, unquote. She's adopted a stigmatizing attitude towards Joe's problem and began to treat him punitively. In this case, Justin would be served by lessening the stigma. If someone has a disease that they didn't cause and can't control, like diabetes or cancer, it's not considered a moral failing. The stigma that some members of society place on substance use disorders causes those who have them to feel shame, and those who don't have them to blame. Again, the place where stigma comes into play in the case of Family O is when Christine gets angry at Joe for being alcohol dependent and begins to treat him punitively. So that's a problem. In order to satisfy the principle of justice, Christine's tendency to be punitive toward Joe should be addressed. Now, there's another element in the family or another place where justice is relevant. Remember that justice becomes important when there are disadvantaged individuals or groups of individuals. And in the case of Family O, the children, Peter and Yvonne, are disadvantaged because they're dependent on their parents for adequate nurturing and care. And that's being threatened in this situation. The laws that support justice for children are important to note. All, quote, mandated, unquote, counselors must report to Child Protective Services or the Administration for Children's Services if they suspect that children are being neglected or abused. And that's important. Those departments will investigate the parents and question the children to try to determine whether abuse or neglect exists in a given situation. If the upshot of that investigation is that children are being abused or neglected, the family may qualify for preventive services, and in the worst cases, the children may be removed from the parents' care. The counselor's report, that is your report, will be a factor in all of that. So we're not going to consider here whether the U.S. laws that protect children are effective and ethically perfect. Practically speaking, if you're a mandated reporter, it's important for you to follow the laws that are now in existence. In the case of Family O, there's a good possibility that the children who are being cared for by Joe, who's under the influence of alcohol, are endangered. Joe cannot be as conscious and alert to potentially dangerous situations as he would be if he were free of all mood-altering substances. Now, finding a path of action that satisfies justice for Joe, who has a substance use disorder, and satisfies justice for Peter and Yvonne as children that deserve adequate nurturing and care may be a hard thing to do. In the process of satisfying justice for children, you may have to use professional paternalism to strongly recommend or leverage the recommendation of Joe into treatment, because Joe may not realize the consequences of his drinking for the children. And you can kind of see where you might get a conflict here between a principle of autonomy, like a principle that says no paternalism, and a principle of justice as it applies to Peter and Yvonne, the children. If you have a conflict of those two principles here, you may decide that justice is the more important one, and you may decide to interfere with Joe's autonomy to some extent. It's clear that in the long run, beneficence seems to require that Joe gets treatment for his alcohol dependence. Now again, that's a call that you would have to make. It seems clear that in the long run, beneficence for the family can be satisfied only if Joe gets treatment for his disorder. Insofar as that disorder has a detrimental effect on Joe's well-being and creates risk to his children, it seems like the principle of beneficence is going to recommend that Joe get better and get treatment for his disease. That might also come into conflict with autonomy. So remember, Joe's autonomy is an important factor, and respecting Joe's autonomy seems to require that you let him make his own choices. But if that principle comes into conflict with the principle of beneficence and the principle of justice, it may be that autonomy gets outweighed. Okay, so it's a difficult choice that you have to make as a counselor. There may be cases that you run into in which you get a conflict between autonomy and beneficence, or between autonomy and justice, where you decide that autonomy is the more important factor, and that should carry the day. So again, I think that this is a really difficult case, and I wouldn't envy you if you were the counselor having to sort out this case. But the way to think about this case ethically is in terms of conflicts between the different principles that we set out at the beginning of the course. Later in the course, we're going to consider one potentially useful tool to make decisions when you have conflicts of the different principles. So you might be thinking, well, in any case where these principles conflict with each other, the decision is going to be somewhat arbitrary, because some people will assign a certain weight, or may give more weight to some principles, and other counselors may give more weight to the others. Now that's true, but it doesn't have to be entirely arbitrary, and there is a way to dig a little bit deeper in those cases of conflict and make a somewhat more principled decision about which principles should, as it were, win in the situation, and which principles might get outweighed. So we're going to look at that later.